Hello everyone. Welcome to this Monday, August 10th. We are having a thunderstorm outside. If you are in an area with some threatening weather, please take shelter and be safe out there. My name is Rendy Murphy. I'm an epidemiologist and the Director of Disease Surveillance and Environmental Services here at the Mobile County Health Department. Delivering our Facebook 2:30 Live update of the impact of the COVID-19 pandemic on Mobile County. I'll skip past the worldwide, national, and Alabama numbers today to focus on what's been happening in Mobile County. Over the weekend, we crossed the threshold of having more than 10,000 cases of COVID-19 among Mobile County residents. Today, in our daily report, we reported on 10,647 cases of COVID-19. Yesterday, we saw another spike in the number of cases reported that is due to aberrations in reporting. We had at least one laboratory who recently came online with electronic laboratories results reporting with the state of Alabama, and they submitted a batch file late last week to catch up on electronic lab reports that had not been submitted to ADPH. So these results began processing late last week, and they showed up in our case count yesterday. And the actual test dates go way back to early in July, but it looks like an enormous spike in our number of cases reported yesterday. The number is 563. So that will be the largest number of cases reported to us in a single day. But again, just to remind you that these things that influence laboratory results reporting really don't have much to do with the way the outbreak the way transmission is occurring in our community. So many of these, most of them, have test dates going back to early July. But I'm glad that we're able to report that that is not a real number, that is an artificially high number of cases reported for yesterday because of a new laboratory coming on board and them catching up with reporting laboratory results to the Alabama Department of Public Health. So we have 215 residents who have died with COVID. In our Ames data, we are aware of 1,487 cumulative number of hospitalized patients that are COVID-19, and about 170 were hospitalized on yesterday. Again, we will continue to make some minor tweaks to this report that is done in collaboration with our partners SSI Group. We probably will be removing the presumed recover indicator off of the report because we know that that is an extremely low estimate of the number of people who are presumed recovered with COVID. As you know, we have had an overwhelming number of COVID laboratory results reported to us, and all of our systems are overwhelmed with trying to gather information on them. And part of that calculation has to do with needing to know if people are hospitalized, and we have switched from getting that information out of our surveillance system to getting hospitalizations from Ames. So those two data systems really don't talk to each other, so it's rather difficult to continue to calculate the presumed recovered and feel good about presenting that number. So today, as soon as I'm done here, I can go back to my desk and press the send button on the email to provide both the daily report to you and our weekly expanded report, which has some information in it that I'd like to review with you. Just again, to discuss kind of the way things are trending in our community, when just looking at things one day at a time doesn't often give us the big picture. So our weekly report is based on data closing out the Saturday before on the previous weekend. So these data are accurate through Saturday, and we know some reports will be added. Some laboratories don't report on the weekend. So if they ran tests on Thursdays and Fridays and then their labs are closed, those laboratory results don't get processed until they come back to work on Monday. So again, it's just there are a lot of nuances about reporting cases of COVID, but I do want to talk about some of the trends that are encouraging. So again, in this report, we have over 10,000 cases. We are still seeing the highest proportion of cases reported in the 25 to 49 age group. Remember, we split the lower age groups out a little bit, so now you can see that we have nearly 3% of our cases are less than 5 years old, around 6% between 5 and 17, and 14% between 18 and 24. And then again, that largest category, the 25 to 49-year-old category, is where we see nearly 40% of our new cases. Most of them are female, and the race and zip code distribution is really not moving around much now that we're upwards, over 10,000 cases. I want to call your attention to page 2 or 3 of our report. From day one, the whole world, all of the states and the Centers for Disease Control began reporting cases by report date. And that report date is the date that is so easily influenced by things like new laboratories coming online, laboratories falling offline, manually entering or manually processing lab results, laboratories being closed on the weekends, those sorts of things. So we know that the pattern, this is what we've been reporting from the beginning. So we will continue doing that, even though you sort of see some things jump around from day to day. But we have also added the same chart by event date. And what event date is that is the date that gets closest to your actual COVID health event. So if you were symptomatic and we've been able to talk to you to find out your illness onset date, event date would be your illness onset date. If we don't have that information, then we populate event date using the specimen collection date. Again, trying to get closest to when your COVID event happened, and that gives us a better idea about how things are trending in the community. So you can see that we've had steady increases week over week. Last week, a lower number have been reported, but as I said, we know that some lab results reported towards the end of the week did not get sent to us until the following week. So we will see where that number lands. We're optimistic that it will be not any higher, hopefully the same or lower than the number of cases reported the previous week. We also have a new chart to show you this line graph, the way cases are trending week over week by age group, again showing you that this turquoise line is where we see the most increase in the number of cases in the people that are 25 to 49, followed by the 50 to 64 group. So bear with us as we work on this graph to get it to where you can easily see what age groups are what color, but we'll improve on that as we go forward. We also calculate the moving average, the 7 and 14-day moving average of COVID cases. That again helps us sort of calm the noise, and right now we're on average, we're adding just under 200 cases per day. Remember, we looked at this graph last week by looking at COVID cases by month. So this is March, which was a partial month, of course, because our first case was diagnosed, or was reported to us rather, on March 19th. Then April, May, June, July. And compared to June, we had more than 3 times the number of COVID cases reported to us in July compared to just the month before. So an alarming increase in the number of cases reported in July, and the reason for this amended safer at home order, the facial covering order, and the extension of those orders through the end of August. We have seen over the last 4 or 5 weeks an increase in the number of deaths, and again that lags behind the number of cases that we see or the number of hospitalizations, but it appears as if that also may be going down a little bit. But still, of the people that have died, most of them, the overwhelming majority, 97%, are 50 or older. So only 7 people with COVID that have died were less than 50 years old, and only 1 person was less than 25. So 89% of people who die have underlying medical conditions. About just under half of them are associated with long-term care facilities, and about 40% require mechanical ventilation while they're hospitalized. So again, not really seeing much difference in the characteristics of our COVID patients who have died, just seeing a bump up in the number of people who've died following an increase in the number who've been hospitalized, and just an overall increase in the number of patients with COVID in July. Again, 3 times the number in July than we saw in June. Another thing that we keep track of are the number of laboratory tests performed, both positive and negative, and we calculate the percent positive laboratory tests. And that is something that we look at closely to sort of monitor what is happening in our community. And I reported last week, and I can continue to report, that the percent positive lab results has stayed about the same or dropped slightly. So back in late June, it popped up to around 22%. Then it started coming down a little bit late July to 17%. And the first week of August, we're averaging about 16%. That probably will go up a little bit as we get more case reports from last week. So we keep an eye on that to help us know how things are trending. It looks like a little bit of good news, but again, we just want everybody to continue to comply with our public health messages to try to keep those trends going in the downward direction. So from Ames data, we have information on all of the people hospitalized in Mobile hospitals. This includes Mobile County residents and residents of other jurisdictions. And looking at, so again, on any given day, lately we have seen anywhere from 180 to 170 people in the hospital on any day with COVID. That seems to be going down a little bit, but we will continue to keep an eye on that and hope that it continues to move in the right direction. So for people hospitalized, again, the overwhelming majority are 25 and over. Only 2% of people hospitalized are less than the age of 25. But I do want to note that we have had a few people in the 0 to 4 category and in the 5 to 17-year-old category that have been hospitalized. A very small number, but I just want to remind you, excuse me, that that hospitalization is something that we are concerned about, even for very young individuals. There have been some recent reports that show that, you know, when children with underlying health conditions are hospitalized, they can have rather severe complications. So average length of hospital stay, 10 days. About 16% of people in the hospital end up dying with COVID. And of the people who are hospitalized, around 77% end up requiring intensive care, and about 63% of those that are hospitalized and died required mechanical ventilation. I need to look at that number because it seems a little off to me. Okay. As usual, we have the map of COVID cases. This is just the COVID cases that have been reported to us in the last 2 weeks. So this gives you a better idea about where COVID transmission is occurring in your community by the zip code of residence of the patient. Doesn't necessarily mean that's where they got exposed, but that's where the people live. So highly likely that they maybe were exposed from a household contact or maybe transmission in their local community. So we have just a couple of questions for today. And it looks like they all came either from Facebook or by email. So someone, I think this came up last week and I maybe didn't get around to it. We were clarifying last week that the definition of close contact, that is being within 6 feet of someone for 15 minutes or longer, and that the 15 minutes or longer does not mean a continuous 15 minutes. It means a cumulative 15 minutes. So the question is, if you were wearing your mask and you find out that you've had close contact with someone who tested positive for COVID, why do you still have to quarantine? So regardless of wearing a mask or regardless of washing your hands, you still have to quarantine for 14 days if you've had close contact defined as within 6 feet of someone for 15 minutes or more, a cumulative 15 minutes. And this is because that, yes, these things add layers of protection. They reduce the amount of exposure that we have to live virus, but it does not eliminate it. So even when I'm wearing a cloth face covering, I could still cough, and I have gaps here, I have gaps here, I have gaps here. I might, pull it down over my nose for a minute when I'm not supposed to. So all of these things result in, the inability to 100% protect you if you are within 6 feet of someone. It's a great barrier, and it will greatly reduce the amount of virus. A lot of my respiratory droplets are going to get trapped in here, but it doesn't guarantee that all of them are going to get trapped. Some can still, escape from my cloth face covering. So that's why you still have to quarantine for 14 days, even if you were wearing your cloth face covering during a close contact with someone who had a COVID-19 positive test. All right, are spikes in cases due to testing college students before classes resume? No, I don't believe that to be the case. We do expect to see an increase in the number of, people in the younger age groups that have asymptomatic infection that is diagnosed by screening on college campuses. But again, if you look at our age chart, most of our sporadic or widespread community transmission has been driven by that 25 to 49 age group. So when we start to see that 18 to 24 age group really start to increase, that'll likely be based on screening of students returning to campuses and being detected as positive when they're showing no symptoms. All right, and then someone asking me maybe to remind people about the importance of, maintaining safe distances, but trying to stay connected with friends and family, just to try to help all of us have a better outlook and better perspective, and just a brighter feeling, a better feeling about staying safe and still conversing with our friends and family. So what I do is I try to pick up the phone more often and call people, friends and family that I want to stay connected with. I try to Skype or FaceTime more often with family members to have a more, facial interaction rather than just the phone. With my neighbors who are older than I am and in risk groups for severe complication, we stand in the yard outside and talk, with a greater than 6 foot distance to try to make sure that we are protected from each other. Also having, a girls' night over WebEx or over Zoom or a conference call will greatly help you stay connected. Also, maybe think about, if sewing masks for donation or, offering to help run, a grocery store errand for a neighborhood family member who is trying to stay out of the public. Those kinds of things can go a long way to helping you feel more a part of the community and try to have more social interaction while still trying to protect yourself and your community from COVID-19. So again, just some of the things that I've been trying to do, and maybe those things would kind of help others and help lift our spirits while continuing to provide safety to those community members who are at highest risk of complication and death because of COVID-19 infection. So again, just to recap, we surpassed 10,000 cases over the weekend, with more than 200 of our community members that have died with COVID. So please continue following the public health advice, covering your cough, washing your hands, staying at home if you're sick, keeping a physical distance of 6 feet when you're out in public, 6 feet from anyone who's not in your immediate household, so that's people that sleep under your roof at night, and wear your cloth face covering when it's a challenge to maintain that physical 6 foot of distance. I try to wear mine anytime I'm out of the house, even if I'm not within, close to 6 feet of someone, because one of the things it helps me do is keep my hands out of my face. And that again is a really good protective barrier. And all of these things layered on top of each other will help us keep transmission slow, or slow the transmission of COVID in our community, and try to keep the number of people who are hospitalized or who die with COVID disease and complication to the lowest that we can, as not to overwhelm our hospitals and make it more challenging to care for those who need hospitalized care. So please continue sending us your thoughts over Facebook. Remember, if you have a complaint, you can send it to iscomplaints@mchd.org. You can always call us for an appointment to get tested by dialing 251-690-8889. And things are, I'm optimistic that some things are beginning to trend downward, but we are still very much in observation mode to see if the safer at home and masking order has the intended effect, and that it can help us in slowing the spread. So we will talk to you again on Friday.